Good afternoon. Welcome to our Series 1A follow-up to HIV and AIDS care, the service code. The learning objectives are spelled out here, and there are 4 of them. The first one is to explain the importance of proper documentation in patient health records, to identify and explain CPT codes, to identify and explain the various codes necessary to report HIV pre-testing, HIV counseling without pre-testing, HIV post-test negative counseling, and HIV post-test positive counseling. The final objective is to identify and explain commonly used modifiers. This slide provides an overview of the commonly used acronyms in this presentation. And this slide goes into the documentation aspect for patients that are coming in for HIV testing and HIV care. As part of the first visit, the documentation should consist of a signed HIV consent form. The HIV test results should be contained in the visit note, as well as notation that the test results were properly communicated to the patient. Your second visit consists of written justification and the rationale for the second or the subsequent HIV test visit. So, for example, when the patient returns for their results, the documentation should include this, that the patient is here today for results, and the additional documentation should also include your treatment plan. For patients that present for HIV pre-test counseling without any testing, the documentation should include written justification that counseling was provided, the reason why the patient declined testing, the follow-up care plan, including any indications for further counseling and testing. So all of this should be documented in a typical record for a patient that presents for HIV pre-test counseling without testing. Okay, so in instances of the signed HIV consent form, you should contact your local state Medicaid agency for further guidance, because this is not consistent across the board, and it varies from state to state. One state may require it where another state may not necessarily require it. HIV counseling and documentation for a patient that has positive results for a symptomatic HIV or the AIDS infection. The documentation for the initial visit for the confirmed results should contain the preliminary or the confirmatory positive test results, referrals for medical care and supportive services, follow-up to confirm continuum of care or the coordination of care efforts, prevention and risk reduction counseling along with a follow-up care plan, partner counseling and assistance including domestic violence screening if this is applicable, and Medicaid provider HIV/AIDS report and partner contact form must also be completed, and it should be documented in the medical record that this was completed. The follow-up and annual assessments should consist of prevention and risk reduction counseling along with follow-up care, and partner counseling and assistance including domestic violence screening if this is applicable. To reiterate, the laws vary from state to state, and some of the Medicaid state agencies suggest the use of a rapid HIV test because it allows the provider to get immediate results and begin follow-up care on an immediate basis. Contact your local Medicaid agency to find out if they prefer you to perform the rapid HIV test or if they prefer that you perform the testing and send it out to a lab for processing. So CPT codes was covered in Series 1, so I'm not going to spend a lot of time on the CPT code set, but I will spend a couple of minutes talking about the HCPCS code set. HCPCS stands for Healthcare Common Procedure Coding System, and it's just another code set that is used to describe procedures and services. This code set is used as a supplement to the CPT coding system, and there are approximately 80% of the HCPCS code system that cross-maps to a CPT code. So you should contact your local Medicaid agency for specific guidance. Some Medicaid state agencies require the use of the CPT code set, and some require the use of the HCPCS code set. So here are the summary of the HCPCS and CPT codes that are used to report the HIV antibody. You have your CPT code. Okay, give me 1 second. So you have CPT code 86701, which is used to report the HIV-1 single result. Actually, this is an error. This should say HCPCS code. So this is HCPCS code G0435. The HCPCS code system is an alphanumeric code set, and the CPT coding system is purely numeric. So anywhere in the slides where you see a code that begins with a letter G, these are your HCPCS codes. So this is a HCPCS code, and it's used to report HIV-1 and or the HIV-2 set. So most of the local Medicaid agencies prefer the combo code because it comprises of both the HIV-1 as well as the HIV-2. CPT code 86702 is for the single result, and this is typically used for the patients that have been diagnosed with the HIV-2 virus. You also have CPT code 86703, which comprises of HIV-1 and HIV-2, the single result. And so again, you need to just follow up with your local Medicaid agency to see if they prefer your G code, G0435, or the CPT combo 86703. CPT 86689 is just the confirmatory test, and this bullet provides an overview of the rapid HIV test codes. So the 4 rapid HIV test codes are G0435, 86701, 86702, and 86703. And these are the manufacturers that you can contact to get the rapid HIV test kits. Most of the Medicaid agencies pay for one HIV test every 6 months. So again, you should contact your local Medicaid agency to find out the specific reimbursement guidelines that are in place. In some instances, it may be necessary for the provider to perform a blood sample or a urine sample collection using routine venipuncture. The code for the routine venipuncture is CPT code 36415. And so in those instances where the HIV test is performed via blood or urine collection, you should be reporting, in addition to the test code, the collection code 36415. The HIV antigen codes are listed here on this slide. So the first one, CPT 87389, is the antibody 1 with HIV-1 and 2 antigens. HCPCS code G0432 is HIV-1 and or HIV-2. And so again, we have this variation of code sets. You have your CPT codes, and you also have your HCPCS codes. You have to follow up with your local Medicaid agency to see which code sets are the most appropriate for the state, for that particular state. So this slide basically just provides you an overview of all of the available HIV antigen codes. You have your CPT code 87534, which is HIV-1 direct probe. And I'm not going to go through all of the codes in detail because everything's here listed for you. CPT 87536 is HIV-1 quantification. CPT 87539 is HIV-2 quantification. So the next slide just speaks about modifiers. And we briefly covered modifiers in Series 1. I believe we covered modifiers, but just an overview, modifiers are two-digit codes. Sometimes they're numeric, sometimes they're alphanumeric, and these modifier codes are used to describe a procedure or service that has been altered by a specific circumstance, but the code itself, the narrative description, is still the same. There are CPT modifiers and there are HCPCS modifiers. So you have to make sure that depending on the modifier type, you append the modifier to the appropriate code type. Some modifiers impact reimbursement. So again, you have to check with your local Medicaid agency to find out which modifiers are applicable and which modifiers impact your reimbursement. Modifiers are never appended to your ICD-9 code set. The ICD-9 codes are covered in Series 2. So the first type of modifier that may often be used on the HIV test codes is Modifier 92, Alternative Laboratory Platform. Basically, this modifier describes a CLIA wave test that is performed in a clinic setting or in a physician's office. And so if you look at the bottom of your slide, the modifier is only appropriate for the following codes that's listed here, 86701 through 86703 and G0433 through G0435. This modifier is only used on the two code sets that's listed here on this slide. So there's an error here. It says do not report with HCPCS codes. That's a mistake. But ultimately what you want to do is contact your local Medicaid agency for specific guidance. Depending upon what your local Medicaid state agency tells you would determine how you're going to utilize the modifiers. The next modifier is Modifier QW, which also means CLIA wave test. So again, it follows the same criteria that Modifier 92 has that we just discussed. You just want to make sure you contact your local Medicaid agencies for specific guidance. The one distinction, though, between Modifier 92 and Modifier QW is that if an encounter requires performing a wave test and a non-wave test, you should not be utilizing this modifier. So in the case of the wave test, if you go back to slide number 13, I apologize, 11. Okay, so your wave test would be the rapid test. So in the case of any of the rapid HIV tests, those are considered your wave tests because those can be performed in the office setting and they deliver quick results. So any of those tests that are designated as rapid would not be appended, the modifier QW would not be appended to those services, those service codes. So let's look at some examples. The first example provides an overview of a HIV pre-testing with preventive care. So a 27-year-old patient presents to their primary care physician's office and advises the physician that they recently had unprotected sex and would like an HIV test. The physician notices that the patient also needs a well visit and decides to perform a well visit. But this particular example is specific to the HIV test code. So for the HIV test code, for the HIV test itself, the correct code is 86701 because the provider mentions in the record that they're performing a rapid HIV. So the test code for a rapid HIV-1 is 86701. And dependent upon the local Medicaid agency, you would either use a Modifier 92 or a Modifier QW. The next slide just provides you the rationale for the code selection. This is an established patient presenting for testing, for HIV testing. The medical record does not state that this is an HIV-2 test. So because there is no indication in the medical record of this being an HIV-2 test, it is presumed that it is an HIV-1 test. So the correct code for this service is CPT code 86701. And based on guidance from your local Medicaid agency, would determine if you're going to use Modifier 92 or Modifier QW. The next example describes HIV pre-testing without preventative care. And so again, it's the same code, 86701, Modifier 92 or QW, depending upon the local Medicaid agency's guidance. So this slide just provides you the rationale, and again, it's the same as the case study number 1. Some coding tips. The 2 coding tips that are outlined on this slide: HIV pre-test with testing and preventative care, including counseling. Report the CPT or the HCPCS code dependent upon the local Medicaid agency, and select the appropriate modifier also based on the local Medicaid agency's guidance. HIV counseling without testing, without preventative care. Typically it's going to be the same code or the same type of code depending upon whether it's a rapid or it's a regular test. Select the appropriate HCPCS or CPT code for the test performed, versus HIV-1 versus HIV-2, or if it's a combo test, HIV-1 and 2. And let's just take a moment to go back to look at the slide. So depending upon whether it's an HIV-1 versus HIV-2, or if it's a combo test, would determine which code type you would select. So if it's just an HIV-1 test, these are your antigens. So if you go back to slide 11, these are your antibodies. So if it's just an HIV-1 test, the CPT code is 86701. If it's an HIV-1 and 2, then it's 86703. If your payer, if the state Medicaid agency tells you to utilize the HCPCS code set, you would utilize G0435. Let's go back. Okay, so the next slide, CPT code 87389 includes 86703. So in the case of coding, most of the codes are bundled into one code that comprises of all of the work necessary to perform the service. And so this slide just provides you this information to provide you with coding guidance, so that in the instance if the provider makes the decision to perform an HIV-1 and 2 test together, the correct code to report is 87389. You should follow up with your local Medicaid agency for specific guidance, as they will tell you which code sets to use and how to report those. The next couple of slides just provide you with additional additional resources, so you can utilize the web resources or you can utilize the textbook resources that are provided in this slide. And this concludes our Series 1A CPT coding. Series 2 will cover ICD-9 coding, and Series 3 will provide an overview of all of the code sets utilized together. That would be your CPT codes used together with your ICD-9 codes.